Hello, everyone. Welcome. Happy Hump Day Wednesday. Hello. I'm going to give everybody a few seconds to get connected and get logged in. My name is Phyllis, and welcome to Florida Training. Tonight, we're going to go over CNA practice tests tonight. So, welcome, everybody. Hello. All right, we're going to go ahead and get started. We have 70 questions tonight. So as soon as if you see the question and you know the answer, go ahead and drop it in the chat. All right, my ladies and gentlemen, let's go ahead and get started tonight. When assisting a client in learning how to use a cane, the nurse aide stands A, approximately 2 feet directly behind the client, B, about 1 foot from the client's weak side, C, about 1 foot from the client's strong side, D, slightly behind the client and the client on the client's weak side. Drop your answers in the chat. Good luck on your exam. Go ahead and drop your answers in the chat. Like I said, once you see it, go ahead and drop it. We have 70 questions tonight. We're going to try to get through it. If you miss anything, you can always go back to the beginning of the video. All right, let's go ahead and dive right into the answer. If you chose D, you are absolutely correct. Slightly behind the client on the client's weak side. The nurse aide should stand on the client's weak side to provide support if the client begins to lose balance. Being slightly behind the client allows the aide to intervene without obstructing the client's movement. Excuse me. When working with a client who has a urinary retention, the nurse aide can expect that the client will A, urinate large volumes, B, be unable to urinate, C, urinate frequently, D, be incontinent of urine. Go ahead and drop your answers in the chat. Drop your answers in the chat. Drop your answers in the chat. All right, let's go ahead and dive right into the answer. If you chose answer B, you are absolutely correct. Be unable to urinate. Urinary retention is the inability to empty the bladder, which may lead to discomfort and a distended abdomen or need for catheterization. Age-related hearing changes result in older clients gradually losing their ability to hear. A, high-pitched sounds, B, low-pitched sounds, C, sound levels, D, faint sounds. Go ahead and drop your answer in the chat and let me know what you think it is. If you are just not joining, welcome. We are going over CNA practice test questions tonight. All right, let's go ahead and dive right into the answer. If you chose A, you are absolutely correct. A high-pitched sounds. Prebiscuits, the age-related decline in hearing, typically affects the ability to hear high-pitched sounds, making it harder for older adults to hear voices or alarms. The best way to safely identify your patient is by A, asking his name, B, calling his name and waiting for his response, C, checking the bed plate, D, checking the armband. Drop your answers in the chat. A, B, C, or D. A, B, C, or D. All right, let's go ahead and dive right into the answer. If you chose D, you are absolutely correct. Checking the armband. Verifying the patient's identity using the arm bandager's accuracy and safety. Relying solely on verbal confirmation may lead to errors, especially with clients who are confused or have memory issues. A client is on a bowel and bladder training program and has not had a bowel movement in 3 days. The nurse aide should A. report it to the charge nurse, B. give the client an enema, C. offer the client prune juice, D. encourage the client to drink more fluids. Go ahead and drop your answer in the chat and let me know what you think it is. Drop your answers in the chat. All right. I see some A's. Some A's. Let's go ahead and dive right into the answer. If you chose answer A, you are absolutely correct. Report it to the charge nurse. Prolonged lack of bowel movement may indicate constipation or other issue that requires medical intervention. It is essential to report this to the charge nurse to address the situation appropriately. The proper medical abbreviation for before meals is APC, D BID, C AC, D TID. The proper medical abbreviation for before meals is A, B, C, or D. All right. Drop those letters in the chat for me. All right, let's go ahead and dive right into the answer. If you chose answer C, you are absolutely correct. AC. AC is derived from the Latin phrase ante cibum, meaning before meals. The abbreviation is commonly used in medical documentation and instructions. A client diagnosed with hypertension will most likely have a history of A, low blood pressure, B, high blood pressure, C, low blood sugar, D, high blood sugar. Drop your answer in the chat and let me know what you think it is. Drop your answers in the chat. All right, I see some B's rolling in. I see some B's. All right, let's go ahead and dive right into the answer. All right, if you chose answer B, you are absolutely correct. High blood pressure. Hypertension is the medical term for chronically high blood pressure, a condition that increases the risk of heart disease and stroke. Yes, they can. A patient who has difficulty chewing or swallowing will need what type of diet? A, clear liquid, B, low residue, C, pureed, D, mechanical solve. You're welcome. Go ahead and drop those answers in the chat and let me know what you think it is. Drop your answers in the chat. All right, let's go ahead and dive right into the answer. If you chose D, you are absolutely correct. Mechanical soft. A mechanical soft diet consists of foods that are easy to chew and swallow. The diet accommodates clients with chewing or swallowing difficulties while maintaining nutritional adequacy. An elderly resident with Alzheimer's disease cannot find her room. How can the nurse aide help the client feel more independent? A, tell her to stay in the room. B, have her roommate secretly watch her. C, place a familiar object on the client's door. D, write the room number on a piece of paper. Go ahead and drop your answers in the chat. A, B, C, or D. Drop your answers in the chat. All right, let's go ahead and dive right into the answer. If you chose answer C, you are absolutely correct. Place a familiar object on the client's door. Familiar objects such as a photo or a personal item help clients with Alzheimer's recognize their surroundings, promoting independency and reducing confusion. How often should a patient's intake and output records be totaled? A, once every shift. B, twice a day. C, every 4 hours. D, whenever the patient requests an intake and output be totaled. Drop your answers in the chat. Ladies and gentlemen, drop your answers in the chat. If I'm going a little too fast, please let me know. It's just we have 70 questions tonight. But so far, you guys are okay. Give me a thumbs up. How often should a patient intake and output records be totaled? A, B, C, or D? All right, let's go ahead and dive right into the answer. If you chose A, once each shift, you are absolutely correct. Intake and output records are typically totaled at the end of each shift to monitor the patient's fluid balance and detect any issues such as dehydration or fluid retention. Which of the following should the nursing assistant observe and record when admitting a client? A, freckles. B, wrinkles. C, short nails. D, bruises. Drop your answers in the chat. A, B, C, or D. A, B, C, or D. A, B, C, or D. If you are just not joining, welcome, welcome, welcome. Welcome. All right, let's go ahead and dive right into the answer. If you chose answer D, you are absolutely correct. Bruises. Documenting any visible signs of injury, such as bruises during admission, is. When responding to a client on the intercom, the nursing assistant should say, A, hello, who is calling, please? B, what is it that you want? C, this is the nursing assistant name and position. How can I help you? D, please hold. I'll have the nurse answer your call. A, B, C, or D. Go ahead and drop your answers in the chat. All right, let's go ahead and dive right into the answer. If you chose answer C, you are absolutely correct. This is the nursing assistant name and position. How can I help you? Providing your name and position demonstrates professionalism and helps establish clear communication. It also reassures the client that their needs will be addressed promptly. Which of the following things should the nurse aide do to familiarize new clients with their surroundings? A, demonstrate the location and use the call light. B, explain that the TV is not to be used. C, instruct family to leave the room after the aide is finished with the admission. D, raise the bed to a high position and raise the safety rail. Go ahead and drop your answer in the chat. A, B, C, or D. Let's go ahead and dive right into the answer. If you chose A, you are absolutely correct. Demonstrate the location and use of the call light. Ensuring clients know how to use the call light empowers them to request help when needed, promoting safety and independence. Other options such as prohibiting TV use or raising the bed to a high position are not helpful or safe practices. When arranging a client's room, the nursing assistant should do all of the following except A. Check the placement on the call bell. B. Adjust the backrest as directed. C. Administer the client's medication. D. Adjust the lighting as appropriate. Go ahead and drop your answer in the chat. Drop your answer. I see some C's. I see some C's rolling in. All right, let's go ahead and see if you are correct. If you chose answer C, you are absolutely correct. Administer the client's medication. Administered medication is outside the scope of practice for nursing assistants. They are responsible for ensuring the room is safe and comfortable, including checking the call bell placement and adjusting lighting and brackets as needed. Backrest is needed, I'm sorry. When assisting a client out of bed, the nurse aide should always A. Employ body mechanic techniques. B. Get another nurse aide to assist. C. Raise the bed to its maximum height. D. Lower all safety rail. Oh, you're going to do good. You're going to do good. And thanks for tuning in. Go ahead and drop your answers in the chat. All right, let's go ahead and dive right into the answer. If you chose A, you are absolutely correct. Employ body mechanic techniques. Proper body mechanics such as bending at the knees and keeping the back straight prevent injury to both the client and the nurse aide. Assistance from another aide or raising the bed may be necessary in certain cases, but using body mechanics is always essential. How often should clients be repositioned during an 8-hour shift? A, every 1 hour. B, every 2 hours. C, every 3 hours. D, every 4 hours. Go ahead and drop your answers in the chat. Congratulations. Passing your exam. Congratulations. Glad I am here to help you on your journey to being in the medical field. All right, let's go ahead and dive right into the answer. If you chose B, you are absolutely correct. Every 2 hours. Repositioning clients every 2 hours helps prevent pressure ulcers, improve circulation, and promote comfort. Which of the following is the correct procedure for serving a meal to a client who must be fed? A, serve the tray along with all the other trays and then come back to feed the client. B, bring the tray to the client first and feed the client before serving the other clients. C, bring the tray into the room when you are ready to feed the client. D, have the kitchen hold the tray for 1 hour. Drop your answers in the chat. Drop your answers in the chat. A, B, C, or D. A, B, C, or D. All right, let's go ahead and dive right into the answer. If you chose C, you are absolutely correct. Bring the tray into the room when you are ready to feed the client. Bringing the tray only when ready to feed the client ensures the food is fresh, warm, and presented in a timely manner, promoting an enjoyable dining experience. The most serious problem that wrinkles in the bedclothes can cause is A, restlessness, B, sleepiness, C, decubitus ulcer, D, bleeding and shock. Drop your answers in the chat. A, B, C, and D. A, B, C, and D. All right, I see a lot of C's coming in. Let's go ahead and see if you are correct. If you chose C, you are absolutely correct. Wrinkles in the bedclothes can create pressure points on the skin, leading to the development of the cubitus ulcer pressure sore, especially in immobile clients. Restorative care begins A, as soon as possible, B, when the client is ready, C, when the client is discharged, D, when the client is diagnosed as terminally ill. Go ahead and drop your answers in the chat and let me know what you think it is. Drop your answers in the chat. Drop your answers in the chat. All right, let's go ahead and dive right into the answer. If you chose A, you are absolutely correct. As soon as possible, restorative care aims to maintain or improve a client's level of function and should start as early as possible to promote recovery and independency. Before placing a client in Fowler's position, the nurse aide should A, turn the client onto her abdomen, B, explain the procedure to the client, C, flatten the entire bed, D, remake the bed with new linens. Drop your answer in the chat. Let me know what you think it is. A, B, C, or D. A, B, C, or D. All right, let's go ahead and dive right into the answer. I see some B's. If you chose B, you are absolutely correct. Give yourself a pat on the back. Explain the procedure to the client. Explaining the procedure ensures the client understands what will happen, alleviating anxiety and gaining their cooperation. Clear communication is key in providing effective and compassionate care. I am absolutely excited about Christmas coming up because it's my birthday month too. So yes, I am very, very excited. It's my birthday month. Of course, I always get short for Christmas, but hey. Excuse me. During hand washing, the nurse aide accidentally touches the inside of the sink while rinsing the soap off. The next action is to A, allow the water to run over the hands for 2 minutes. B, dry the hands and turn off the faucet with the proper towel. C, repeat the wash from the beginning. D, repeat washing, but for a half time. Drop your answers in the chat. If you chose C, you are absolutely correct. Repeat the wash from the beginning. Touching the sink contaminates the hands, requiring the entire hand washing process to be restarted to maintain proper infection control standards. How should a nurse aide dress for a job interview? A, wear a clean t-shirt and casual slacks. B, wear a nurse aide uniform. C, wear a business suit, dress, or pants and dress shirt. D, wear formal attire. Drop your answer in the chat. A, B, C, or D. A, B, C, or D. All right, let's go ahead and dive right into the answer. If you chose answer C, you are absolutely correct. Wear a business suit, dress, or pants and dress shirt. Dressing in professional attire demonstrates respect for the interviewer and seriousness about the position. A nurse aide uniform is not usually appropriate for interviews unless permission to do so is granted beforehand. An ambulatory client is newly admitted. Before leaving the client alone, the nurse aide should A, ask if the client is hungry, B, inspect the client's skin. C, assess the client's intake and output. D, make sure the client knows how to use the call bell. Go ahead and drop your answer in the chat. A, B, C, or D. A, B, C, or D. Let's go ahead and dive right into the answer. If you chose D, you are absolutely correct. Make sure the client knows how to use the call bell. Ensuring the client knows how to use the call bell promotes their safety and ability to call for help when needed. When lifting a heavy object, the correct method would be to bend at the A, waist, keeping your legs straight. B, waist rounding your shoulders. C, knees, keeping your back straight. D, knees and waist. Go ahead and drop your answers in the chat. Drop your answers in the chat. Let me know what you think it is. All right, let's go ahead and dive right into the answer. If you chose C, you are absolutely correct. Knees, keeping your back straight. Proper body mechanics, such as bending at the knees while keeping the back straight, prevent injuries to the nurse aid and ensure safety lifting. When should nurse aides wash their hands? A, before eating. B, before using the bathroom. C, after client care. D, before cleaning a bedpan. Drop your answers in the chat. Go ahead and drop your answers in the chat. Let's go ahead and dive right into the answer. If you chose C, you are absolutely correct. After client care, hand hygiene is crucial after any client care to prevent the spread of infections, while the other actions also require hand washing. Client care is emphasized in this content. When assisting a client with eating, one of the first things the nurse aide should do is A, cut the food into bite-sized pieces. B, wash his own hands and the client's hands. C, butter the client's bread. D, provide the client with privacy. A, B, C, or D. Go ahead and drop your answers in the chat. All right, let's go ahead and dive right into the answer. If you chose B, you are absolutely correct. Wash his own hands and the client's hand. Proper hand hygiene for both the nurse aide and the client reduces the risk of infection and ensures a safe eating environment. A patient has a new cast on her right arm. While caring for her, it is important to first observe for A, pulse above the cast. B, color and hardness of the cast. C, warmth and color of fingers. D, signs of crumbling at the cast end. Go ahead and drop your answers in the chat and let me know what you think it is. Drop your answers in the chat. All right, let's go ahead and dive right into the answer. If you chose answer C, you are absolutely correct. Warmth and color of fingers. Monitoring the signs of circulation, such as warmth and color, is essential to detect complications like impaired blood flow. Encouraging a client to take part in activities of daily living, ADLs, such as bathing, combing hair, and feeding is A, done only when time permits, B, the family's responsibility, C, necessary for rehabilitation, D, a violation of client's rights. Go ahead and drop your answer in the chat and let me know what you think it is. All right, let's go ahead and dive right into the answer. If you chose C, you are absolutely correct. Necessary for rehabilitation. Participating in ADLs help clients maintain independency, improve physical function, and support rehabilitation goals. In caring for a confused elderly man, it is important to remember to A, keep all bed rails up except when you are at the bedside. B, close the door to the room so that he does not disturb other patients. C, follow the agency's policy for caring for a confused patient. D, remind him each morning to shower and shave independently. Go ahead and drop your answers in the chat and let me know what you think it is. A, B, C, or D. A, B, C, or D. Go ahead and drop your answer in the chat. All right, let's go ahead and dive right into the answer. If you chose answer C, you are absolutely correct. Following the agency's policy for caring for a confused patient. Following the agency policy ensures that care is provided safely and consistently while adhering to legal and professional standards. Bed rails A may pose a risk of injury or restraint and should be used according to policy. Closing doors B may isolate the patient and increase confusion. Encouraging independent activities D may not be appropriate if the patient lacks capacity for those tasks. Before assisting a client into a wheelchair, the first action would be to check if the A client is equitably covered, B floor is slippery, C door to the room is closed, D wheels of the chair are locked. Go ahead and drop your answers in the chat and let me know what you think it is. A, B, C, or D. All right, let's go ahead and dive right into the answer. If you chose answer D, you are absolutely correct. Wheels of the chair are locked. Locking the wheelchair wheels is a crucial safety measure to prevent the chair from moving during transfers. A client has a weak left side. When transferring the client from the bed to the wheelchair, the nurse aide should stand A on the right side, B in the front of the client, C on the left side, D behind the client. Go ahead and drop your answers in the chat. Go ahead and drop your answers in the chat. All right, let's go ahead and dive right into the answer. If you chose C, you are absolutely correct. On the left side, the nurse aide should stand on the client's weak side to provide support and prevent falls during the transfer. This ensures the client's safety. When moving a wheelchair onto an elevator, the nurse aide should stay A behind the chair and pull it toward the aide, B behind the chair and push it away from the aide, C in front of the client to observe the client's condition, D at the side of the wheelchair while opening the door. Drop your answers in the chat and let me know what you think it is. All right, I see some A's and C's. All right, let's go ahead and dive right into the answer. If you chose A, you are absolutely correct. Behind the chair and pull it toward the A. Pulling the wheelchair into the elevator allows better control and ensures the safety of the client, preventing the chair from tipping. While making rounds at 5:30 a.m., a nurse aide finds a patient lying on the hospital floor. What should the nurse aide do first? A. Call 911. B. Perform CPR. C. Call for help. D. Assess the client's pulse and respirations. Go ahead and drop your answers in the chat and let me know what you think it is. All right, let's go ahead and dive right into the answer. If you chose C, you are absolutely correct. Call for help. While assessing a patient's pulse and respirations is important, it should be done after calling for help to avoid delaying crucial support. Hospital staff do not normally call 911 for medical emergency. Also, performing CPR would only be appropriate if the patient is not breathing or pulseless. The Foley bed must be kept lower than the client's bladder so that A. Urine will not leak out, soiling the bed. B. Urine will not return to the bladder, causing infection. C. The bag will be hidden and the client will not be embarrassed. D. The client will be more comfortable in bed. A, B, C, or D. Go ahead and drop your answers in the chat. I see a lot of B's. Let's go ahead and dive right into the answer. If you chose B, you are absolutely correct. Urine will not return to the bladder, causing infection. Keeping the Foley bed below the bladder level prevents backflow of urine, which can introduce bacteria and cause a urinary tract infection, UTI. You guys on a roll tonight. As an afternoon snack, the kitchen sent a diabetic client a container of chocolate ice cream. The nursing assistant should first A. Substitute diet soda for the ice cream. B. Hold the afternoon snack and report to the charge nurse. C. Call the kitchen and report the error. D. Allow the client to have half of the ice cream. Go ahead and drop your answers in the chat and let me know what you think it is. A, B, C, or D. All right, I see some B's and C's, so let's see who's right. If you chose B, you are absolutely correct. Hold the afternoon snack and report to the charge nurse. A diabetic client's diet must be carefully monitored. Reporting to the charge nurse ensures the appropriate corrective action can be taken. When assisting a client who is using the commode, it is important to A. Leave the call light within reach. B. Lock the door to promote privacy. C. Stand next to the client until the client is finished. D. Restrain the client to prevent a fall. A, B, C, or D. A, B, C, or D. All right, I see the A, B, and C's. All right, let's go ahead and dive into the answer. If you chose A, you are absolutely correct. Leave the call light within reach. Ensuring the call light is accessible allows the client to request assistance when needed, promoting independency and safety. Ensuring adequate circulation to tissue is a major factor in preventing skin breakdown. This can be accomplished by doing all of the following except A. Performing active or passive ROM exercises. B. Using mechanical aids. C. Giving back rubs. D. Positioning the patient every 4 hours. Drop your answer in the chat and let me know what you think it is. All right, let's go ahead and dive right into the answer. If you chose D, you are absolutely correct. Positioning the patient every 4 hours. Clients should be repositioned every 2 hours, not 4, to prevent prolonged pressure on the skin, which can lead to breakdown and pressure ulcers. The purpose of cold applications is usually to A, speed the flow of blood to the area, B, prevent heat exhaustion, C, prevent or reduce swelling, D, prevent formation of scar tissue. Go ahead and drop your answers in the chat. Go ahead and drop your answers in the chat. All right, let's go ahead and dive right into the answer. If you chose C, you are absolutely correct. Prevent or reduce swelling. Cold applications constrict blood vessels to help reduce inflammation and swelling in an injured area. A warm compress is an example of A, local dry heat application, B, generalized dry heat application, C, local moist heat application, D, generalized moist heat application. Yes. Drop your answers in the chat. All right, let's go ahead and dive right into the answer. If you chose answer C, you are absolutely correct. Local moist heat application. A warm compress applies heat to a specific area of the body, making it a local application. Additionally, because it involves moisture, usually a cloth soaked in warm water, it is classified as moist heat rather than dry heat. This combination helps improve blood flow and reduce pain or stiffness in the target area. All right. Clients receiving an enema are usually placed A, on the right side, B, on the left side, C, flat on the back, D, in a semi-sitting position. A, B, C, or D. Go ahead and drop your answer in the chat. All right, let's go ahead and dive right into the answer. If you chose B, you are absolutely correct. On the left side, the left lateral Sims position is ideal for administrating enemas as it facilitates the natural flow of the solution into the rectum and colon due to ectominal structure of the lower gastrotectinal tract. Can't talk tonight. A female client's perineal area should be cleansed before which specimen is collected. A, 24-hour urine specimen. B, pediatric routine urine specimen. C, midstream clean catch urine specimen. D, routine urine specimen. A, B, C, or D. A, B, C, or D. Let's go ahead and dive right into the answer. If you chose C, you are absolutely correct. Midstream clean catch urine specimen. Cleansing the perineal area helps prevent contamination of the urine specimen with bacteria from the skin, ensuring an accurate test result. The most common site for counting the pulse is the A. Carotid artery, B. Femoral artery, C. Brachial artery, D. Radical artery. A, B, C, or D. Go ahead and drop your answer in the chat. Let's dive right into the answer. If you chose D, you are absolutely correct. Radial artery. The radial artery located on the thumb side of the wrist is the most accessible and commonly used site for measuring the pulse in routine practices. When counting respirations, the nurse aide should A. Wait until after the client has exercised, B. Not tell the patient what he is going to do, C. Count 5 respirations, then check his watch, D. Have the client count respirations while the aide takes her pulse. Drop your answers in the chat, A, B, C, or D. Right, let's go ahead and dive right into the answer. B. Not tell the patient what he is going to do. If the patient knows their respirations are being counted, it may alter their breathing rate. The secretly observing while performing another task, such as taking the pulse, provides an accurate count. Which of the following is not the nurse aide's responsibility when caring for clients who have urinary catheters? A. Preventing infection. B. Ensuring the catheter drains properly. C. Inserting the catheters. D. Recording urinary output. Go ahead and drop your answer in the chat and let me know what you think it is. Let's dive right into the answer. If you chose C, you are absolutely correct. Inserting the catheter. Inserting a catheter is a skilled nursing procedure. The nurse aide's responsibilities include monitoring for proper drainage, preventing infection, and recording output. When giving information to the charge nurse for an incident report, the nurse aide should A. Write in the client's chart that an incident occurred. B. Keep the report in her personal file. C. State the facts clearly. D. Give her opinions as to the cause of the incident. A, B, C, or D. Go ahead and drop your answer in the chat and let me know what you think it is. All right, let's go ahead and dive right into the answer. If you chose C, you are absolutely correct. State the facts clearly. Incident reports must be factual and objective to ensure accurate documentation. Opinions or assumptions should not be included. A long-term care nurse aide must be competency evaluated and must complete a distant educational course. These requirements are set by A. Oprah 87, B. OSHA, C. CDC, D. FDA. Go ahead and drop your answers in the chat. All right, let's dive into the answer. If you chose A, you are absolutely correct. Oprah 87, the Omnibus Budget Reconciliation Act of 1987 establishes federal standards for nurse aide training and competency evaluation to improve the quality of care in long-term facilities. A resident is blind. It is important not to A. Leave the door completely closed. B. Rearrange the furniture. C. Announce yourself before entering the room. D. Explain the location of food on the plate using the face of the clock to assist. Drop your answers in the chat, A, B, C, or D. All right, so we got between D, B's, and C's. Let's see what the answer is. If you chose B, you are absolutely correct. Rearrange the furniture. Blind residents rely on familiar layouts for mobility and safety. Rearranging furniture can disorient them and increase the risk of accidents. When family members visit a client, the visitors should A. Stay in the day room, B. Stay a short while so as not to tire the client, C. Be accepted to help with care, D. Be allowed privacy with the client. A, B, C, or D. A, B, C, or D. Drop your answers in the chat. A, B, C, or D. All right, let's go ahead and dive into the answer. If you chose D, you are absolutely correct. Be allowed privacy with the client. Privacy during family visit respects the client's dignity and promotes emotional well-being by fostering a sense of normalcy and intimacy. Which of the following is a client's right? A. Having personal information kept confidential. D. Obtaining private duty staff if desired. C. Knowing what is wrong with the client's roommate. D. Treating the staff any way he or she pleases. Which of the following is a client's right? A, B, C, or D? A, B, C, or D? All right, let's go ahead and dive right into the answer. If you chose A, you are absolutely correct. Having personal information kept confidential. Maintaining confidentiality of personal information is a fundamental client right protected by the laws such as HIPAA. The other options are either incorrect or violate ethical standards in healthcare. A resident asks if I need help during the night, who will be there? The nursing assistant should respond: A. Don't worry, you'll be okay. B. Just yell, someone will hear you. C. Your roommate will probably ring the call bell. D. There are people here all night to help you. A, B, C, or D? All right, let's go ahead and dive right into the answer. If you chose D, you are absolutely correct. There are people here all night to help you. This response reassures the residents and provides factual information, alleviating anxiety about nighttime assistance. A resident often cries while she is receiving her PM care. What should the nurse aide do? A. Tell her to stop crying. B. Ignore her and continue with her care. C. Tell her jokes to make her laugh. D. Tell her that it's all right to cry and that the aide is there for her if she wants to talk. A, B, C, or D? All right. I see some D's, A's. Let's dive into the answer. If you chose D, you are absolutely correct. Tell her that it's all right not to cry and that the aide is there for her if she wants to talk. Providing emotional support and allowing the residents to express feelings fosters trust and emotional well being. Ignoring or dismissing her emotions should be insensitive and counterproductive. When providing when denture care, the nurse aide must A. Wash them in boiling water. B. Hold them under warm running water. C. Dunk them in and out of cool water. D. Place them in a towel in the sink with cool water. Go ahead and drop your answers in the chat and let me know what you think it is. A, B, C, or D. All right, let's go ahead and dive into the answer. If you chose D, you are absolutely correct. Place them on a towel in the sink with cool water. Placing dentures on a towel in the sink prevents damage if they are dropped. Cool water helps preserve the denture shape and prevents warping. Sexuality in long-term care clients may include all of the following except A. Needing private time with a partner. B. Caring about one's physical appearance. C. Engaging in public fondling. D. Desiring sexual interaction. Go ahead and drop your answers in the chat and let me know what you think it is. A, B, C, or D. Let's see some C's and D's. Let's see what the answer is. If you chose C, you are absolutely correct. Engaging in public fondling. When sexuality is a normal part of life, public fondling is inappropriate in a long-term care setting. Privacy and respect for others are essential. A client is scheduled for a partial bed bath. This means that the nurse aide must wash the client's A. Face, neck, ears, arms, and legs. B. Face, axilla, hands, and buttocks. C. Face, hands, axilla, and legs. D. Face, hand, axilla, genitals, and buttocks. Drop your answer in the chat. I see some A's, B's, C, D. All right, let's dive into the answer. If you chose D, you are absolutely correct. Face, hands, axilla, genitals, and buttocks. In a healthcare facility, a partial bed bath focuses on areas that most require hygiene and freshening, particularly those prone to odors and irritation. A goal for extended care facility (ECF) residents is that she's not swear at the nurses or aides. When she calls an aide by his name, the appropriate action is to A. Smile and give positive reinforcement. B. Continue whatever task that is being done. C. Tease the residents about not swearing. D. Tell all of the staff that she didn't swear. A, B, C, or D. All right, let's go ahead and dive right into the answer. If you chose answer A, you are correct. Smile and give positive reinforcement. Positive reinforcement encourages desirable behavior and reinforces the goal. Ignoring or teasing the residents does not contribute to behavior modification. An agitated resident must be turned every 2 hours all night long. The first action of the nurse aide when waking up the residents is to A. Turn on the light. B. Speak quietly and calmly. C. Touch her shoulder. D. Shout her name. A, B, C, or D. All right, let's go ahead and dive right into the answer. If you chose B, you are absolutely correct. Speak quietly and calmly. A calm and quiet approach reduces agitation and confusion, making the residents more cooperative with care. If a client objects to certain food for religious or cultural reasons, the appropriate action would be to A. Tell him to wait for the next meal. B. Call the kitchen the next day. C. Offer to substitute something different for him. D. Tell him he needs to eat what is on his tray. A, B, C, or D. Okay, I see some C's. All right, let's go ahead and dive right into the answer. If you chose C, you are absolutely correct. Offer to substitute something different for him. Respecting cultural or religious dietary restrictions promotes clients' dignity and autonomy. Forcing a client to eat foods they object to is inappropriate. The client's religion forbids eating pork. Bacon is being served for breakfast. The most appropriate response is to A. Encourage the client to eat it because she needs protein. B. Tell the client it is all right since her doctor ordered the diet. C. Ask for a tray without bacon. D. Tell the client that restrictions are not as important as her health. A, B, C, or D. All right, let's go ahead and dive right into the answer. If you chose C, if you chose C, you are absolutely correct. Request a tray without bacon. Providing an alternative that aligns with the client's religion beliefs, respects their rights, and fosters trust. Encouraging them to eat against their beliefs is insensitive and unethical. Which type of communication can often be most powerful? A. Written. B. Verbal. C. Silent. D. Techno. A, B, C, or D. A, B, C, or D. All right, let's go ahead and dive right into the answer. If you chose C, you are absolutely correct. Silent. Silent communication can be very powerful because it often conveys empathy, concern, and understanding. It allows clients to feel heard, and respected without words. Verbal communication is also important, but silence can sometimes speak volumes, especially in emotional situations. A client refuses to allow the nurse aide to bathe her. The nurse aide tells the client that she will not be allowed to eat her lunch or go to bingo if she does not have her bath. This is an example of A. Rehabilitation, B. Discipline, C. Verbal abuse, D. Physical abuse. Drop your answer in the chat. Drop your answer in the chat and let me know what you think it is. All right, let's go ahead and dive right into the answer. If you chose C, you are absolutely correct. Verbal abuse. The nurse aide is attempting to manipulate or control the client with threats, which is considered verbal abuse. It is not acceptable to coerce or threaten clients in order to perform care. This is a violation of ethical standards and the client's rights. On entering a room, an aide notices that the client is not breathing. The aide first action should be to A. Call for help. B. Lay the client down on his back. C. Give 4 quick breaths. D. Give 8 to 10 abdominal thrusts. A, B, C, or D. Okay, I see some A's and B's. I see all of them. So let's go ahead and dive right into the answer. If you chose A, you are absolutely correct. Call for help. The first step in responding to an unresponsive client is to call for help or alert emergency services immediately. After this, the nurse aide can begin CPR if trained. ensuring professional help is on the way is critical. A client's dentures are lost. The first action should be to A. Notify the administrator, B. Look for them, C. Notify the doctor, D. Notify the charge nurse. A, B, C, or D. All right, let's go ahead and dive right into the answer. If you chose B, you are absolutely correct. Look for them. The first step in responding to a lost item such as dentures is to search for them. If they cannot be found, then the appropriate personnel, charge nurse, or administrator should be notified to assist in resolving the issue. Nursing assistants are responsible for A. Planning client care, B. Comparing assignments with coworkers, C. Performing without ever asking for help, D. Doing tasks assigned by the charge nurse. A, B, C, or D. Go ahead and drop your answers in the chat and let's see what it is. If you chose D, you are absolutely correct. Doing tasks assigned by the charge nurse. Nursing assistants are responsible for performing tasks that are delegated to them by the charge nurse, but they do not plan client care or perform tasks beyond their scope of practice. Collaboration with other healthcare team members is also an important aspect of their role. A patient turns on the call light when he needs to urinate. The appropriate action is to A. Ignore the light since he is not the aide's own client. B. Announce on the intercom that there are two patients ahead of him. C. Answer the call light and get the urinal. D. Answer the call light when the aide has the time. A, B, C, or D. Okay, let's go ahead and dive right into the answer. If you chose C, you are absolutely correct. Answer the call light and get the urinal. The nurse aide should respond promptly to the call light and provide the client with the necessary assistance, such as bringing a urinal. Ignoring the call light or delaying the response is unprofessional and neglectful. A client is in the prone position. The nurse aide finds the client vomiting bright red blood. The nurse aide should first A. Clean up the vomit. B. Provide the client with a mist basin. C. Place the client in the side lying position. D. Call the charge nurse. A, B, C, or D. Go ahead and drop your answer in the chat. A, B, C, or D. All right, let's go ahead and dive right into the answer. If you chose C, you are absolutely correct. Place the client in the side lying position. The priority is to place the client in a sideline position to prevent aspiration of blood into the lungs. This reduces the risk of choking and ensures the airway remains clear. The nurse aide should then call for help and notify the charge nurse immediately. When performing catheter care, the nurse aide should wash the catheter A. toward the meters, B. with betadine soap, C. away from the meters, D. with alcohol. Drop your answers in the chat and let me know what you think it is. A, B, C, or D. Let's go ahead and dive right into the answer. If you chose C, you are absolutely correct. Away from the meters. When cleaning a catheter, the correct technique is to clean away from the meters, the opening where the urine exits. This helps to prevent bacteria from entering the urethra and causing infections. Always clean the catheter gently and thoroughly. A nurse aide who applies restraints on a client without directions from the charge nurse may be accused of A. Slander, B. Battery, C. False imprisonment, D. Negligence. Drop your answers in the chat. A, B, C, or D. All right, let's go ahead and dive right into the answer. If you chose C, you are absolutely correct. False imprisonment. Applying restraints without proper authorization from the charge nurse is considered false imprisonment. Restraint should only be used under specific guidelines and with proper orders to avoid violating the client's rights. HS care is care that is given A, before meals, B, before bedtime, C, after meals, D, upon awakening. A, B, C, or D. Drop your answers in the chat and let me know what you think it is. A, B, C, or D. A, B, C, or D. A, B, C, or D. All right, let's go ahead and dive right into the answer. If you chose B, you are absolutely correct. Before bedtime. HS means before sleep or bedtime. HS care typically includes activities like assisting the client with personal hygiene and preparing them for sleep. The best food choices for geriatric client with no teeth would include A, hamburger, french fries, corn, and ice cream. B, baked chicken, dressing, green beans, and coconut macaroons. C, spare ribs, macaroni and cheese, coleslaw, and fruit cocktail. D, baked fish, whipped potatoes, spinach souffle, and pudding. Go ahead and drop your answers in the chat and let me know what you think it is. A, B, C, or D. A, B, C, or D. All right, let's go ahead and dive right into the answer. If you chose D, you are absolutely correct. Baked fish, whipped potatoes, spinach souffle, and topico. For a geriatric client with no teeth, food choices should be soft, easily chewed, and nutrient dense. Baked fish is easy to chew, while whipped potatoes and spinach souffle are soft and provide essential nutrients. Pudding is a smooth dessert that will also be easy to swallow. Avoid foods that are tough or require significant chewing, such as the options in the other choices. A client's family wants to talk about the client's impending death, but the client does not want to talk about it. The family should be encouraged to A, carry on the conversation away from the client, B, talk freely in front of the client in order to help the client to accept it, C, wait until the client dies to talk about it, D, force the client to talk about it with them. Please rewrite these CNA practice questions and include the correct answer and detailed rationale for each. A, B, C, or D. Let's dive right into the answer. If you chose A, you are absolutely correct. Carry on the conversation away from the client. It is essential to respect the client's wishes. If the client does not want to discuss their impending death, the family should be encouraged to have that conversation privately away from the client. This approach ensures that the client's emotional and psychological needs are respected while also giving the family the space to discuss their concerns. Forcing the client to discuss something they're not ready for could increase stress and anxiety. Bonus question. Did you enjoy this video? A, yes, it was fantastic. B, yes, I learned a lot. C, yes, it was super helpful. D, yes, I can't wait for more. Go ahead and drop your answers in the chat. Did you enjoy this video? All right. All right. There was no right or wrong answer to that. Enjoyed this video? Don't forget to like, subscribe, and share. For more amazing videos, please go to www.youtube.com/Florida Training. Also, you can visit us at floridatraining.com for free resources. If you have any questions, I am going to type in the chat an email about any questions, concerns. Give me 1 second. Let's see. I am typing in the chat. Ladies and gentlemen, that is it for me this week. Please be on the lookout for me next week. I'm sorry, y'all. I'm trying to type it. Let's see. So, yes. Those type of questions for the Florida State, please send an email to that, and that question will be answered. Admin@floridatraining.com. Admin@floridatraining.com. So great job, team. Like I said, comment, like, share, and subscribe. My name is Phyllis. You guys have a wonderful rest of the night. Oh, the blood environment. Enjoy the rest of your week. And like I said, be on the lookout for me next week. Good night, everybody.